think about healthcare, you might first think about the expensive acute care that we read about in the headlines. But if you ask family physicians, they'll tell you that 90% of your healthcare is in the community. But really, who provides almost all of your healthcare? It's not doctors, it's not nurses or other healthcare providers like me. It's you. Real healthcare is self-care. The best predictor of your future health are the habits you practice today. So the 4 foundations of good self-care are what you eat, what you do, how you feel, and how you relate. What do you put into your body, both healthy and unhealthy things? What do you do with your body? Physical activity that supports all the activities of daily living and helps you do what's meaningful for you. How do you relate to other people? How do you connect? At home, work, and school, and with society. And finally, how do you feel? How do you recognize your emotions and how do you manage them? And how do you live a meaningful life? The doctors who compose the divisions of family practice care for our patients in our practices, care for you individually, but now care for our community as a whole. And we're involved in other stakeholders in providing the best healthcare that you can have and to make you the best self-care provider. Let's talk about important screening tests. What tests do you need and when do you need them? Screening tests are things that the general population should have at different ages. And it's kind of by consensus with the medical experts based on research, so it changes over time. But they find that it's cost effective and it saves lives to do these tests. So they're used for people that don't have symptoms. So if you are having symptoms for these conditions, don't bother to wait for a mammogram if you feel a lump in your breast. See your doctor right away. So don't wait to do the screening mammogram. And if you're having abnormal bleeding, don't wait to have your next pap smear, but see your doctor right away and get investigated. So if you have family history, that's different. So if you have family history of colon cancer, you're going to start screening sooner than the average person. There might be a different screen as well. So screening tests are for the general population of average risk without any symptoms. If you have symptoms, see your doctor. Don't wait for a screening test. So pretty well every adult over age 18 should have their blood pressure checked. And the guideline is pretty vague. It says at every appropriate medical visit. But I think every adult over age 18 should check it about once a year. And if it's abnormal, then it should be checked more frequently. Your doctor can advise you. When I was in medical school, they used to tell us that a normal blood pressure is 100 plus the patient's age. So that 20-year-old is 120 and the 80-year-old can have 180. So that's not the case anymore. And a number of years ago, we wanted 120 over 80 for everyone, or at least less than 140 over 90. So the newest guidelines have changed a little bit so that over 80 will be happy enough with 150, because we know that drastically reducing the blood pressure might cause more harm to the patient than good. But every adult over age 18 should get their blood pressure checked at least once a year, and more frequently if you have high blood pressure already. So again, for the people that don't have problems and they're asymptomatic. So the screening for cervical cancer is the pap smear. So that's part of the pelvic exam, but not every time you have a pelvic exam do you have a pap smear. So I always tell my patients what we're taking swabs for if they're getting their pap smear when we're doing the examinations. Always important to explain. So the new guideline is that women between 25 and 69 should have their pap smears every 3 years. But it is customary when women start to have their paps at 25 that the cancer agency will tell us if we need to repeat it after 1 year, and after they've had 2 normal, they usually move them to 2 or 3 years. So we get the guideline, but that's the general guideline for women between 25 and 69. Now, if a woman is over 70, she's allowed to stop the pap smears after 3 successful normal paps in the last 10 years. So if you get 3 in a row that are normal, then you win and you don't have to do the pap smear. However, if you have pelvic symptoms or abnormal bleeding, you should still see your doctor, because the pap smear is just screening for one small area of the pelvis. It's just the cervix for cervical cancer. You can have other tumors or growths and things that need to be looked after. So the screen for diabetes used to be simple. We used to screen everyone over age 40. So the screening test is the hemoglobin A1C. So it's a single tube of blood that checks your average blood sugars over the past 3 months, the sugars that are attached to red blood cells, which live for 120 days. Alternative screening tests are the fasting blood sugar, that's in the morning before you've had anything to eat, or the glucose tolerance test where you come in fasting and we give you the sugar to eat to see what happens to your blood. So those last two tests actually are hard for patients to set up, so that's why they've defaulted to the A1C. That could be done at any time. But they said those at high risk for diabetes, according to risk calculators, the FIND risk and the CAN risk calculators, should be screened every 3 to 5 years. And people that are at high risk, like very high risk on those calculators, every year. But unfortunately, you probably can't tell if you're high risk unless you put yourself through these risk calculators. But in general, if you have other risk factors for heart disease, high cholesterol, high blood pressure, strong family history of diabetes, if you've had diabetes during pregnancy, if you're overweight, you probably are at increased risk. And you should ask your doctor if you should be screened for diabetes. Part of the reason that we're promoting these screening guidelines is doctors get very busy treating the problems that patients bring in, because the current model for healthcare has been patients bring in their problems. And then sometimes doctors have to work pretty hard to be very proactive and saying, in addition to your problems today, by the way, you're due for this screening test. So the screening mammogram is the screen for breast cancer. But again, if you have a lump, if you have family history of breast cancer, if you're a higher risk, then don't wait for the screening mammogram. Talk to your doctor of how you should be checked out. So the screening mammogram changed recently. We used to start screening all women, recommending at age 40 every year till age 50, then every 2 years till age 70. But the new consensus is to start at age 50 and to do it every 2 years. So women who are 40, in my practice, I still encourage them to come in sooner, just because I know it will detect cancers earlier. So I discuss it with women, let them know these are the current guidelines, this is the evidence, and what do they feel most comfortable, this is what I recommend. So the current guidelines are these. And once you start with the program, they'll send you a reminder. But I do have a lot of patients that are very healthy, over 70, and a long life expectancy. I expect them to live more than another 10 years because they take very good care of their health. Everything else is fine. So I can write them a note so they can continue screening. So if you're over 70 and you're really healthy, talk it over with your doctor. You should continue the screening mammograms every 2 years. And then finally, screening for colon cancer. So the general screen is checking the stools for occult blood. And it's not as scary and ghostly as it sounds. That means just for hidden blood that you can't see. So we used to call it the fecal occult blood test, where you did 3 samples, but now we call it the FIT test because it's a very quick 1 sample test that's much more specific and sensitive. So everyone over 50 without family history of colon cancer should do it every 2 or 3 years. If you have family history, talk to your doctor, because usually we go straight and recommend colonoscopy, getting the surgeon to put a scope up the rear end, and then screening every 5 to 10 years, depending on your history. If we do find blood in the stool, then we usually refer for a colonoscopy, discuss it with the patient. And just remember, with all these screening tests, if you have symptoms, don't wait for the screening test, see your doctor. So screening for prostate cancer, the recommendations have changed, but the usual screen is the digital rectal exam. So when we first started calling it this, a lot of men were kind of excited to do this new high-tech digital rectal exam to check their prostate. And then I showed them that the digit was just my gloved finger. So kind of disappointing, but there was no wait. So men over 50 in general should start checking their prostate every year. But if they're starting to get those symptoms of decreased flow, we should check them at that time. So men in the audience, this is when you're getting the digital rectal exam, it's the wrong time to ask for a second opinion. So the doctor tells this patient that I just checked your prostate, and the patient's sweating, that you have a large prostate and you need to have surgery right away. And the patient's sweating. He says, "Really, doc, can I have a second opinion?" I said, "I already did. I used 2 fingers." So just remember, screening tests are people of average risk with no symptoms. If you have any of the symptoms we talked about, then don't wait for the screening test. See your doctor right away.